Welcome to the Prospective Doctor podcast brought to you by MedSchoolCoach. Each week we cover topics related to the pre-med journey to medical school and beyond, from the MCAT to completing your application and from starting medical school to choosing a specialty. Our podcast will provide essential information for anyone contemplating a career in medicine.
Hey everyone, thanks so much for joining me today. It's Dr. Marinelli here. Today I have Dr. Joel Ramirez, who is our USMLE Tutoring Director at MedSchoolCoach. So I wanted to take a few minutes today to talk about USMLE, as we haven't really touched on this subject in our podcast before. Joel, thanks for joining us.
Yeah, of course. Thanks for having me. I'm excited to be here.
So just to start off, because I know when I was a pre-med student, I definitely didn't know what the USMLE was. And even as a medical student, when I started, I had a pretty minimal understanding of what it was. So can you just kind of give an overview of what we're talking about when we were talking about the USMLE?
Yeah, exactly. So the USMLE stands for the United States Medical Licensing Exams, and it is a multi-step exam that you take throughout, essentially at different steps in medical school. And it's all leading you to licensure. So the step one is the one that's really commonly talked about. It's a very challenging one. It's usually taken after the first 2 years, or now almost the first 3 years for medical schools. The curriculums are changing, but it's the first step of the three-step exam. That one's really focused on basic science. And then there's a step two, clinical knowledge, also known as step 2 CK, which is usually taken after your year of clinical rotations. And then there's kind of a counterpart to the clinical knowledge, which is the step 2 clinical skills exam, which is another exam but this one's a bit different. Instead of a multiple choice exam, it's actually an in-person exam, which you are examining fake patients and taking histories and physicals from fake patients and trying to test your ability to extract information from people and then apply that information. And then the third step of this multi-step exam is actually taken after medical school, usually during or at the end of your first year residency. Mm-hmm. So total of 4 exams, 3 are taken in medical school and 1 is taken at the end of the first year residency. And once you complete all those, then you're eligible for licensure, receiving your medical license in the United States.
Okay, awesome. That is a lot of exams, and definitely I don't think, something that we all know when we're starting medical school. I think people pretty much assume doctors have to take lots of tests, but when you put it and break it down like that, it definitely makes more sense. What are the purpose of these tests? Obviously, you mentioned that you have to take these in order to get licensed, so you're demonstrating your proficiency in medicine and what you're learning. But what would you say are the overall purpose and why students should care about the exams?
Yeah, and I definitely think that you kind of nailed it on the head. And there are a lot of exams, and they're really difficult and they're really long. So step 1 is like 7 or 8 hours, and step 2 is a similar amount of time. So these are very, very long, very difficult exams. And so their role is essentially multifactorial. So I think at the most basic, like you mentioned, it's you get a passing score and you're able to move forward towards receiving your license. You've demonstrated some sort of minimum proficiency of knowledge, which is required to take care of patients and take care of people. Mm-hmm. I think the next important kind of aspect of the exams, which becomes more important every year as residencies and you go to medical school gets more and more competitive, is that these exams all, except for the clinical skills exams, they all are on a number scale. And so that number then is going to go on to your application into residency. So just like the MCAT or the SAT, your score will be associated with percentile. Mm-hmm. And if you have so many people applying to residency, then one easy way for program directors to weed folks out is to look at percentiles of these USMLE exams. So some specialties which are really small, something like neurosurgery or orthopedic or vascular surgery, which they're not taking many residents, oftentimes the numbers to even be considered go higher. And there's just greater numbers and the percentile is higher because it's essentially a more selective specialty. And it makes it's just another barrier to get in. So performing well in these exams has become extremely important to the point where if you are interested in a really competitive specialty and you don't perform well on a exam or any of the exams, then your chances of matching that specialty get lower and lower, essentially the lower your score gets. Okay. So it's really important to take them, and not only to take them, but to really focus your efforts to try to excel on them, so that when you're choosing your specialty, or if you've already chosen your specialty, your number is not going to hold you back.
Mm-hmm. Couple questions for that, Joel. So for the people out there that may be wondering, is this an exam that you can take multiple times, similar to the MCAT, to get like a greater score? Let's say you don't score well the first time and you really want to go into neurosurgery, so you want to get a higher score. What are your options there?
Yeah, so that's kind of the next aspect that makes these exams pretty tricky and makes it important for you to perform well on the exam the first time you take it. If you do not receive a passing score, you can retake the exam. But if you receive a passing score, you cannot retake the exam. Mm-hmm. So if you pass by 1 point, that is the score that you are stuck with, and you cannot retake it. So that further emphasizes the importance of taking it once and preparing for it the most correct way, and really doing your very best on that one exam attempt. Mm-hmm. Because if you pass, that's your score. There's no changing that.
Mm-hmm. Which definitely makes it difficult for those people that maybe didn't perform well on that exam and want that really competitive specialty. Now they have to take ownership of it and start to try to make up their application in other ways. When I was in medical school, most of the emphasis, as you mentioned too, was placed on step 1, which is the exam taken after the second or third year. Is that pretty much the same trend now in residency placement, or has that changed at all?
So that's actually changed, particularly with the more competitive specialties. So I still say step 1 is slightly more important, but for a lot of residency programs, they will not rank you unless you have a step 2 CK score. So what that means is the program will see your step 2 CK score. So it's really not something you want to blow off. And unfortunately, they both are extremely important. And then the step 2 CK can also play an additional role if you did not perform as well as you wanted to on step 1. Step 2 CK could really be your opportunity to try to make up for that. Mm-hmm. In contrast, if you don't take it as seriously as you did for step 1 and you don't do as well, that also can reflect poorly. And nowadays, they did a survey of program directors, and the step 2 CK score was the 5th most important thing that a program director looked at when selecting students for interviews. The most important was step 1, but step 2 CK was still the 5th most important, just above your personal statement. So step 2 CK is, by a perspective of a program director, more important than your personal statement.
Very interesting. Good to know. So let's kind of leave everybody today on some thoughts on step 1, since this sounds like the test that they need to prioritize the most, and also that they are going to encounter this first. And certainly in upcoming podcasts, we can dwell much deeper into this and talk more about each of the exams. But I think it would be a good idea just to kind of leave off on that as our initial discussion of the USMLE. So what do you suggest to most incoming medical students in regards to, should they start preparing? When should they start preparing? Should they be even thinking about it?
I think it should be something you think about. I think it now depends on your curriculum. So some schools, the more traditional kind of curriculum is that you do your 1 and 2 preclinical years, and after your 2 preclinical years, you take step 1. Mm-hmm. A lot of schools now are going your essentially like a year and a half preclinical, and then you do your year of core rotations, and then you take the exam. Mm-hmm. So I think the first step is figuring out what kind of curriculum does your school have, and that is really going to determine what you do. If you're taking the exam at the end of 3rd year, then starting from day 1, it doesn't really make sense to be preparing for this exam. I think the most important thing, if you're a medical student entering medical school, the first thing is, I think the reality is you don't really know what you want to do yet. And if you think you do, it might change. Mm-hmm. So the most important thing for everybody is to take the exam seriously and try to perform your best. Whatever your best is, that is what you really want to put forward, so that if you change your mind or if you fall in love with the specialty, you won't be limited. But there's also no reason to be stressing from day one. So the most important thing for a brand new medical student is to really focus on learning medicine. So learning what you're being taught in your courses. It might not feel like it all the time, but what you're being taught in your courses is going to show up on step one in some form. Mm-hmm. And so the best thing you could do early on is to really focus on your coursework and focus on learning these difficult concepts and all the physiology and the biochemistry. And although you'll probably forget a lot of it, when you do return to study for step one, I think it comes back a lot quicker if you learned it well the first time. So that's kind of the most important thing. When you're getting closer to the exam, whether you're taking it at the end of your second year or you're taking it at the end of your third year, you really want to think about it seriously about 6 months before. You don't necessarily need to start studying 6 months before, but you really want to make sure that it doesn't sneak up on you. So 6 months before, you should be thinking about what kind of resources should you use? What kind of learner are you? How do you perform on standardized tests? How has medical school been for you so far? If it's been a really big challenge, you might want to give yourself some additional time to study. But all these things you want to think about 6 months ahead of time so that you're not surprised. Mm-hmm. And then I would, depending, you have to reflect on how you've done in medical school and what your goals are. But I think it's very reasonable to study for 1 month full time, which is what most schools will allow you to do. Mm-hmm. And then anywhere from 2 to 4 or 5 months part time. I think that's very reasonable. So if you're someone who is not very good at standardized tests, and you know that, and you're interested in neurosurgery, then you're really going to want to study for that full time for the month and probably part time for 4 or 5 months. Mm-hmm. Now, if you're looking to do a less competitive specialty and you historically have done very well in medical school and very well on standardized tests, then I think it's reasonable to study full time for a month and then part time for 1 or 2 months. But I think that takes some reflection and some introspection and some understanding of yourself as a student and your goals.
Yeah, absolutely. And just to wrap up, would you mind going over a little bit of how the tutoring with MedSchoolCoach works and how the tutors actually kind of help applicants figure out some of their strengths and weaknesses and where they really need to concentrate on their studies?
Yeah, absolutely. So I think it ties really back into what we started with, which is you want to do it right the first time and you want to do your best, your personal best, whatever your personal best is. Everyone should be on that same page. Take it once and do your personal best on that first try. Mm-hmm. And so I think tutoring just plays a role in a few things. So I think the most valuable thing for tutoring is that it's a one-on-one individualized experience. And so I'm sure in your experience in medical school, and definitely in my experience in medical school, is you really never got one-on-one attention. Yeah. Usually it's some sort of lecture, or at the most it's like a small group when it's, you and maybe 10 others. Sure. But you never really get one-on-one attention. And that's really important because everyone's different and everyone learns differently and everyone has a different path. And so having someone, an expert on these exams, all of our tutors have performed extremely well on these exams and are really gifted tutors, to sit across from one of these tutors and to get their personalized and individualized attention and advice is very valuable. For example, if you're not a flashcard person, then it's probably not a good idea to try to do flashcards. Mm-hmm. If you learn a certain way, then maybe your tutor can help integrate those learning methods into your study plan. Mm-hmm. And there's also a lot of resources for step one. Not all of them are good, and you might not be using them the right way. And so our tutors have worked with a lot of students. They have not only been very successful on their own exams, they've worked with a lot of students, and they kind of have an idea of what works, what doesn't work, what works better, and what works worse. And so I think one of the most important things is identifying an important list of resources and creating an individualized study plan to get you on the right track from day one. So you are not wasting your time studying things that are not worthwhile or studying inefficiently, because you really don't have the time to waste. You're a busy medical student and you don't have unlimited time. Mm-hmm. And I think the next most important thing is really helping you where things are difficult. So is a certain subject challenging for you? Do you have difficulties going through questions? Do you have difficulties, with multiple choice answers? Do you have difficulties identifying what is important while you're studying? So a lot of students will say, first aid is a really big book. I don't know what is important. And I think working with a tutor who has gone through that experience and has identified what is important, it becomes a lot clearer, and they're able to help you identify things that are going to be important for your studying. So I think all those kind of culminate in a more supportive and effective study plan. So you're maximizing your time and you are essentially removing inefficiencies in your studying.
Absolutely. Awesome. Well, thank you so much, Joel. That I think was really helpful. I mean, even being out of the test for several years, it's a lot of stuff that I even forget. And definitely for somebody that's just kind of looking into it and trying to get their feet wet on at least what they need to be thinking about, that was really helpful. So thanks so much. We definitely want to have you on for multiple more episodes and break this down even more for us.
Yeah, of course. Happy to do it. There's always so much to talk about. They're very long, difficult, and pretty involved exams.
Yeah, absolutely. Thanks, Joel.
All right, take care.
Our mission is to inspire, encourage, and inform students as you journey through a rigorous and intricate process of achieving your dreams in medicine. Visit us at prospectivedoctor.com and MedSchoolCoach.com for more essential resources in your medical school journey and beyond.